Second, all 367,000 doses have arrived at over 170 hospitals over the last couple days. And of course, we had 5 major hospital systems the previous week receive some of the initial doses of the Pfizer vaccine. They were getting additional Pfizer this week. We also were able to do 20,000 doses for the state strike teams. So we did over 100 long-term care facilities in 6 days in Pinellas and Broward counties because there was a high concentration of those facilities. We also have CVS and Walgreens are actively pursuing and vaccinating seniors and staff of long-term care facilities. That's been their mission that they've been contracted with the federal government. So there's a lot of great things going on, a lot of hope, a lot of optimism, and I think that that's a good thing going into a new year. I want to make an important announcement here today. This morning, I'll be signing an executive order that makes it clear our seniors are going to be the first priority in the general community to receive the COVID vaccine. As you know, we focused the initial week and then now into this week with the hospitals on long-term care residents, staff of long-term care facilities, and the frontline healthcare workers, doctors, nurses who are dealing with coronavirus patients day in and day out. But I said at the beginning, once we're able to do that with those initial doses, we want to work to get this out to our senior population. We think that that's very, very important for reducing mortality, reducing the number of people that need to be hospitalized for COVID-19. So the question is, and we made clear the reason why we did this, even though this was our initial guidance, is because the CDC had an advisory committee that actually initially recommended seniors not even be next in line, that you do essential workers, many of whom are very young, many of whom do not have significant health problems. And I think that would have been a huge mistake. It would have increased mortality for sure compared to what would have been done. They've now said, well, you should do essential workers and 75 and up at the same time. The problem is people that are 73, 74 would be in the back of the line for a young 21-year-old worker who's considered, quote, essential. That doesn't, I think, make sense. And so for us in Florida, we're making clear in this executive order that our first priority for the general population, once the nurses, the doctors, and the long-term care facilities are done, is to vaccinate people 65 and up. And that's going to be clear in the order. We also say for hospitals, regardless of age, if there's somebody that is extremely vulnerable to COVID, then obviously you use your medical judgment on that. So if you have a cancer patient or something, of course we want to give hospitals the ability to do it. But the broad outreach for the community is going to be our 65 and plus population. So this means that our healthcare providers, whether it's hospital systems or the state, the county health departments throughout the state of Florida, they have the guidance about the way forward, particularly once we get through the frontline healthcare workers. Most hospitals, as I mentioned, have received either Pfizer or Moderna at this point. And once a hospital completes the mission with vaccinating frontline workers, they can immediately turn their attention to individuals 65 years and older, as well as I mentioned some of those folks that they may be hospitalized for really serious conditions and are extremely vulnerable to COVID-19. In addition to hospitals, our county health departments are beginning to receive a small amount of the vaccine, and they will begin administering the vaccine to individuals 65 and older as early as this coming Monday. And we'll have more information on that as we get closer. Now, here is what we have to tell people. We don't have enough vaccine to do everyone 65 and older in Florida at this moment. We have over 4 million people in that age group. We have vaccine doses that are in the hundreds of thousands over and above eventually once we get through the long-term care and the nurses. And so we're going to continue to get vaccine every week, and we obviously are going to want to really make that available. But I would just caution folks who are in that 65 and older, don't rush to your local hospital or county health department. Right now, you're going to have an opportunity to sign up, I think in very short order. We are going to be getting it to the county health departments, but it is going to be a relatively limited supply. So just say bear with us. Our priority is the elderly population, If we have enough vaccine, we'll get it out. As we continue to get more and more, we can make it broader and broader. But the bottom line is the state of Florida is prioritizing our COVID-19 vaccine for our seniors. They will have priority over ordinary workers who are under 65, and I think that that's the appropriate way to do. But I'd also like to underscore a lot of the progress that's been made. Just last week, we had to limit the Pfizer vaccine to 5 pilot hospitals who had the ultra-cold storage capability. It's -70-degree requirement to store the Pfizer. And while I directed these hospitals to give neighboring hospitals their excess vaccine, there were still many areas of the state that did not quite have access. For example, here in Northwest Florida, once the 367,000 doses of Moderna arrived, that has all changed, and because the Moderna vaccine does not require ultra-cold storage, we were able to send the vaccine to 173 different hospitals throughout the state of Florida. And now, after a little over a week, we were the first state in the nation to begin vaccinating residents of long-term care facilities, and we're up to, I think as of this morning's report, close to 70,000 shots have been administered in the state of Florida in roughly a little over a week's time. So it's been, when I was here last, I guess over the summer, I mean, when we first started this, I remember working with Sacred Heart to just try to get people to have a test in March and April. It was like there were no tests available. Built up a big infrastructure on that. I remember when they started to have therapeutics come online like remdesivir, we made sure that the hospitals had that. We have had good reports on the latest monoclonal antibody treatments, and they're using it here at Sacred Heart. There's been reports nationally about hospitals not using it, that they don't have the facilities or they just don't have the wherewithal to do it. I can tell you, the hospitals I'm talking to in Florida, they've embraced it. They're using it, and I think the results have been very, very positive for high-risk patients who get infected with COVID-19. So that has been great. But this, I think, is really a great step for us in this. I think it gives a lot of people a lot of hope. We're going to continue to get hundreds of thousands of doses of this every week for the foreseeable future. We also think, and by February, we'll probably have access to the Johnson & Johnson vaccine if the data on that ends up being solid and it gets an emergency use authorization by the FDA. That will be one shot, normal refrigeration, and produced at a pretty large scale. So we're looking at every week, I think, being able to make a lot of progress, and hopefully by the time we get into February, you're going to start to see not just Pfizer, not just Moderna, but maybe the Johnson & Johnson, and really have this thing start to get out broader, even beyond our 65 and plus population. But we're going to be working very, very hard as we continue with the long-term care mission, working with CVS and Walgreens, as the hospitals continue with their mission to complete the vaccination of their ER docs, ICU nurses, all the people who are in close contact. That we work really, really hard to get it out to our 65 and up in the community. So Florida is going to be very, very clear on that. We are setting priorities. We're going where the risk is greatest and where we think the impact will be the most consequential. So I look forward to continue to working with everyone around the state over these coming weeks and continuing to provide this vaccine to all those who want it. And as more and more people have had it, more and more people have been interested in getting it. We're obviously not going to do any type of mandate in Florida, but I think people look, they see, and it's worked by and large, I think, very well for most people. So you're going to continue to see, I think, more and more people show an interest in this. So we're going to do. Are you going to say a few words, and then we'll go ahead and do our vaccinations here, so everyone can see that, and I'm happy to take a couple questions.
So first, I want to tell you, Governor, thank you. Thank you for your leadership. Thank you for helping us with the distribution of our vaccine. We are so grateful here in Ascension Gulf Coast to be able to receive the Moderna vaccine here in our Pensacola market on Monday. We received it at 9:30 and was vaccinating at noon. Yesterday, just here in the Pensacola market, we vaccinated over 700 first healthcare workers, the Phase 1A healthcare workers, the ones at the highest risk of caring for our COVID-19 patients. Within our Ascension Gulf Coast market, every single hospital we have has the vaccine. We are vaccinating actively today. We have vaccinated at the end of the day yesterday, close to 1,200 Phase 1A healthcare workers. The emotion is extremely high. I mean, it is the most exciting work we've ever been able to provide here within our ministry market, within our Florida market. It's, I have to say, like we've heard many words, today's the day healthcare goes on offense. We have been on defense for so long. We have worked tremendous hours. We have lost friends. We have lost patients. It's been tough. But over the last 24 hours, thanks to you, Governor, and in your leadership and our Ascension Gulf Coast Ministry leadership, we're on the offense. We're fighting back. We are vaccinating. Our goal is to help with the vaccination of our community. Every community our hospital sits in, we're going to be there. We're going to help support every initiative we have to be able to fight this pandemic, to get us back to a little bit of normalcy in our life. It's been a great last 24 hours, so we appreciate all of your help, all of our Gulf Coast Ministry help. The one thing, though, with our vaccine coming to market, it's really important still that everybody still social distance, masking, washing your hands. I mean, even with the vaccine here, we don't need to let our guard down. We need to be able to help, get that message out to our friends, especially going to our Christmas time within our holiday. Everybody wants to celebrate and have a good time, which is great. I mean, we have things to be thankful now. We're thankful for the vaccine coming to market. We're thankful to be able to start moving into the next phase of this pandemic, which is hopefully to the end of this pandemic, and get our economy back to normal, get our healthcare workers to be able to spend more time at home with their families. This is a great day, but at the same time, still practicing social distancing, still wearing your mask, still ensuring that if you're sick, stay at home. Don't come to work, don't spread the virus until we're able to do our job and be able to vaccinate our community and be able to get ahead of this pandemic. Thank you so much, Governor.
Okay, who do we got coming over here? You want to introduce yourself and then set them now?
Governor. My name is J.C. Crenshaw, and I've been here at Sacred Heart for 8.5 years. I'm Senior Director of Support Services.
Awesome.
C-R-E-N-S-H-A-W. Yes, sir.
Are you from Florida originally?
Born already.
Okay.
Dr. Divinity, but Senior Director of Support Services.
Good to go? How was it?
It was good.
All right. Well, thanks for doing it. We appreciate it. Yep. Next. Introduce yourself.
Hello, I'm Stephanie Booth. I'm a nurse manager here at Sacred Heart. I've been here for 5 years.
Great. Now, before they do this, they're filling out forms and everything is locked and loaded? Yep. And then do you guys give them the appointment to come back in if it's Moderna, I guess 28 days, or how are you doing that?
We have an automated system that will help remind them for their 21-day or 28-day vaccine.
So the Moderna is a 28-day, Pfizer's 21. Now you have a few days on each side, but so basically if they're getting vaccinated just before Christmas, you're looking at kind of that probably mid to late January timeframe. We'll have to go get their booster shot.
And Governor, also too, we do monitor all of our associates for 15 minutes in our observation area to ensure there's no reaction.
Yep.
And it's been very successful.
Great. How was it? All right, thanks for doing it.
Good morning.
Good morning.
Morning. My name is Jiang Truong. I'm a physician, neonatologist. I take care of little babies in the neonatal ICU.
Great. All right. How was it? There we go. All right, thank you. So you see, quick and easy. They go in, they get it, and then they're out. And obviously, there's going to be the 15-minute observation period, which obviously makes sense. They think that they've gone through a lot, as was mentioned, but they think they can do even more, particularly as we get out into the community. So that's going to be great. The first shot, most people have said, provides some protection before you even get the booster. So that in and of itself will make an impact in terms of reducing the severity of the disease burden. I also want to thank Ascension Sacred Heart. There's going to be a need to go out into the community and not just have everyone come here. I mean, we have, I think Senator Broxton had mentioned, we have some folks who are very elderly who aren't in nursing homes, but they're doing home care, and they may not have the wherewithal. And so they're already working with the county health department. They're working with their folks to be able to go out and help those vulnerable individuals. And I think it's really going to require a team effort to make sure that we're getting it in the places that need it the most. So thanks, everyone, for all your hard work, really, over these many, many months. But now we are, I think it was said, on offense, and this is a really important mission for our entire healthcare system here in the state of Florida, for the county health departments and everything in between, to be able to deliver this vaccine to the folks that want it. We saw the healthcare workers. We know the nursing homes are underway. And then the next step will be our 65 and plus population. So we look forward to be able to offer that to our senior citizens. With that, I could take a question or two.
Governor, you said that you heard here today the importance of continuing to wear masks and social distancing. 2 weeks ago, you attended the Nice High School football game where there was little social distancing. You weren't wearing masks. Most people in the crowd weren't wearing masks. How do you expect people to follow those rules and take this kind of seriously?
Well, first of all, I've never put rules in for outdoor activity. I don't think that's not something I've advocated for. I think the outdoor transmission has been close to zero. We've seen that. And so we've typically tried to advise, if you're in close contact, particularly in a poorly ventilated environment. And so there was really no inconsistency with anything I've said.
President Trump this morning said that
Does anyone else have any questions? Yes, ma'am.
Some politicians have really been falling under backlash for receiving the vaccine ahead of these other age groups, like you mentioned, 65 plus. What do you think about that, and is that impacting if and when you will receive the vaccine yourself?
It has an impact because I made the decision very early. We're setting criteria, and I'm going to follow the criteria we set. It makes no sense for someone that's 42 to jump ahead of somebody that's 70 years old. I mean, you can look at the data on this. It's very clear. And so I want to make sure that if there's one dose here in Pensacola left for this week, I want it to go to an elderly. I don't want it to go to me. And I think that some of the folks, look, people got to do what they got to do. But I mean, for me, I don't think it's justifiable for me to go ahead in the line. And so we have a system. We want to get the elderly. And then at that point, as we get into the next, hopefully, phase where maybe we get the Johnson & Johnson and you have all this, and if that proves to be effective, which we hope it will be, then I think you have an opportunity for kind of the broader public to be able to do it. I think you're going to see a lot of law enforcement folks, not that they're high risk, but if you have an outbreak and you have 10 deputies that have to isolate, that hurts the force. Fire, I think you'll see teachers. I think you'll see some of these other workers in industry, some of people working for utilities, all this. I think there's going to be a lot of interest in getting it at that time. And we obviously want to be there and be able to provide support that we can. But in terms of elected officials jumping the line, you're not going to see that with me.
President Trump said this morning that he might consider vetoing the stimulus bill that was passed last night that would give Americans $600 each, as well as a slew of other financial things. Would you support President Trump vetoing that bill? Do you think it should be done, or do you think Americans should get that veto?
Well, I think it's hard to know when they write a 5,000-page bill, they publish it at, I think, 3 o'clock in the afternoon, and then they pass it at 9 at night. Now, I don't know about you all, but I can't read 5,000 pages in 6 hours. It just ain't going to happen. And so there was a lot of stuff tucked into that bill that it's going to take weeks for us to try to figure out. I've got people digging in to see what does it mean for Florida. We're going to have to spend probably the next 2 or 3 weeks going through that to try to do it. And so what I would say is, I mean, he's got to make decisions he wants, but there could have been more relief targeted to people that have been hurt since the coronavirus started, and hurt a lot of it through government policies. I mean, some of these states are shut down. They've still had massive outbreaks, and yet they have all these people that have been out of work. In Florida, we've really tried to make sure people had the ability to earn a living. It's very important to do that. You can still mitigate and do things responsibly, but throwing people out of work just doesn't make sense. And so there was very little. I think the total amount of the payments was like 190 billion, and they're spending all this other money. They're sending money to Pakistan. They're sending money to all these things. This is a situation where our country has had problems. Let's address those problems. And I think it showed exactly why we need term limits for members of Congress, because they're not going to change the way they do business. They're going to continue doing it this way. And there's a lot of stuff in there, I think, that we need. I think people need relief. I think we need to have support for the vaccination programs on the COVID side. So yes, there was some stuff that's needed, but they got sidetracked. They put a lot of other stuff in there that really shouldn't have been. And I think it's because this is the way they do business. It's a few people in the leadership that jam this stuff through. And then we have to look as taxpayers and try to figure out whether this is something that is good or not. Could you at least have waited another year for Pakistan? Could we have just not sent all this money overseas, given all that the country's going through right now? And I think we could have done it. I'd like to see them support working folks more than they did in the bill. But when I was in Congress, I supported term limits because I understood the need for it. If we could end up moving in that direction, I think you'd see more responsiveness coming out of the Congress. And so it's disappointing there was a lot of that stuff in there. We're going to figure out whether this stuff, what it means for Florida. I know we've been looking through the transportation. We've been looking through some of these other things. So we'll be able to potentially make some announcements about how we're going to deal with this if he does, in fact, sign the bill. Obviously, it passed with a very big margin. So, whether a veto would be effective or not, I mean, I don't know. They'd have to look at the numbers on that. But passing bills without reading it, that's not the way you should do business. And I think it was kind of sad to see just the way it was going. We've been waiting for a bill since June. We thought we'd get something in June, then July, then they broke for August recess. Then we said, okay, they got to get something done before the election, right? They didn't do anything for the election. Obviously, there was political reasons why they didn't do that, particularly Nancy Pelosi saying she didn't want to do it then. And then we thought, okay, maybe they'll do something right after the election. No, we're right on the eve of Christmas now. So they've really had 6 months to think about this, and to do it in that way with 6 months, it was disappointing. But we'll make the best out of it in Florida, no matter what happens. And we're happy to say we've been really responsible with our budget situation. We're going to be able, I think, to continue a lot of the progress we've made. I mean, I've had to make tough choices early on with some of the budget vetoes, but we really believe that we're going to be in good fiscal shape in the years ahead. Thanks, everybody.